There's a international measles outbreak right now. We are doing probably better than certainly better than any of the other industrial countries in the world in controlling it. The outbreaks are actually declining.
Measles cases in the U.S. are at their highest level since the disease was declared eliminated. That was back in 2000.
Alarming new data shows that measles cases in the United States have reached a 33-year high. That is according to new data out of Johns Hopkins University, hitting more than 1,200 confirmed cases across 38 states and Washington, D.C. The largest outbreak remains the one we've covered here, the one in West Texas. Officials there have recorded more than 750 cases of measles and believe the true toll is much higher than that. At least 155 people have been hospitalized across the country, and 3 people have died, including 2 otherwise healthy children in Texas and a man in New Mexico, all of whom were unvaccinated. To understand just how devastating this year has been, only 3 measles deaths were reported between the year 2001 and 2024.
Canada now has tripled the number of measles cases compared to the United States, despite having 300 million fewer people.
Alberta now has more confirmed cases of measles this year than the entire United States, after 30 more people were diagnosed with the virus over the weekend. The province is reporting more than 1,300 infections since the outbreak began in March. Now, by comparison, the U.S. CDC is reporting more than 1,200 cases of the highly contagious disease this year.
There's no doubt that this is an epidemic.
We have CDC teams everywhere where governors have requested it. And we are also taking care of those populations that don't want to vaccinate. Most of the cases are unvaccinated Americans. There are some populations that do not want to vaccinate. We're making sure that there are protocols for treating people who actually get measles. But we don't at this point consider it a national emergency. Most of the cases are unvaccinated Americans. There are some populations that do not want to vaccinate. We're making sure that there are protocols for treating people who actually get measles. So, if in the individual states, if there are issues, we are there for them. But we don't at this point consider it a national emergency.
Do you see this measles outbreak as an emergency?
Well, it's the biggest measles outbreak we've had in this country in 33 years. We've had 2 healthy young children, 8 and 6-year-old little girls in West Texas who died from measles. That's the first death of a child in this country since 2003. And that child in 2003 was immune compromised. Yes, I consider it an emergency, and I think what Robert F. Kennedy Jr. should do as head of Health and Human Services is use his platform, stand up and loudly and clearly say, we need to vaccinate our children. I think that the statement that you just played was pretty weak. I think he needs to get up there and take his position and make it clear that these are preventable deaths, and it's unconscionable that children in this country are dying of measles when it is a preventable disease.
How would you describe, Doctor, what he and what HHS have been doing when it comes to vaccines?
Well, this outbreak is a perfect example. I mean, if you look on the CDC's website, it says that there's been roughly 1,300 cases of measles. That is a vast underestimate of the actual number. If you talk to people on the ground, they think it's at least 3,000 cases. And worse, for example, there was immunization clinics in Dallas. There were about 21 immunization clinics that were set to go, but yet they had their funding cut back, so they couldn't vaccinate children in high-risk areas. We're not doing what we need to do in this country, in large part because of cutbacks in surveillance for measles from the CDC and also in local health departments. It's hard to watch.
Let's talk about some of your latest health headlines. We're looking at a new COVID variant. People say feels like a razor blade pain in your throat. Doesn't sound pleasant. We've also got the latest on the measles cases.
Yeah, never good. Athena Kehoe joins us now in the studio with what you need to know. Athena, it sounds like staying healthy right now is critical.
And this new COVID variant is called Nimbus, and many people know it as the disease that makes your throat feel like you're swallowing razor blades, which is not a very comforting thought. I spoke to Lindsay Kohler, who is an epidemiology division manager with the University of Arizona, to find out how concerning this is. She says this variant has been found in Region 9, which includes Arizona, but so far it hasn't been detected in Pima County.
It's very similar to what we've been seeing. We don't have any reason to think that it's more severe than the previous variants, and so the course of healing would be similar to what we've seen in the past, maybe up to a week or so of not feeling great. So if you have that cough, congestion, fever, stay home if you're not feeling well.
Vaccines remain the most effective tool to both avoid measles and to keep the infection from spreading. And yet, over the past few years, the vaccination rates for MMR, the vaccine that protects against measles, has declined.
It's a very contagious disease, and the virus spreads very easily.
For decades, the United States has had a handle on measles. The disease declared eliminated in 2000 due to a highly effective vaccination program, according to the CDC. But so far this year, the CDC has documented 1,288 confirmed measles cases, the highest number since 1992.
I think it's a consequence of lower vaccination rates. And unfortunately, with measles, it doesn't even have to be that low to get cases to circulate.
According to CDC data, the rate of kindergartners receiving state-required vaccinations dropped from 95% during the 2019-2020 school year to less than 93% 4 years later. Roughly 280,000 kindergartners are not fully vaccinated with the 2-dose measles vaccine.
The real kind of notorious thing about measles is that by the time you've had that rash, which is characteristic and kind of tips you off to having measles, you've been infectious for like 4 or 5 days already.
We heard that Alberta has the highest number of measles cases per capita in North America. I mean, how do you react to that? Why is this province the hardest hit right now?
Well, I mean, this is just an appalling situation. This is not something that I expected to see in my lifetime as an infection doctor, because measles has had eradication status in Canada for many years. And the scale of this outbreak is really massive. And, you know, Alberta, like many places, you know, is not a single population. There's many populations within a population. And I think that what we're seeing is very under-vaccinated populations are having very high rates of disease. And it's basically network spread. And so it's very hard to contain that. And that's what happened in Ontario as well, I think.
When you're talking about that, of course, in part is the fact that it is such a contagious disease. And so that can also lead to several complications too. So how concerning is that spike and the spread?
Well, we haven't really seen, we haven't really seen it leveling off. We're seeing continued spread. We're seeing more involvement in the larger cities, Edmonton, Calgary, which have very high vaccination rates. And we know, as you said, that if measles is around and you're vulnerable, there's a 90% attack rate. And so any given exposure can result in many secondary infections. And, you know, most people think of measles as a rash illness, but really it's a whole body illness that can have serious consequences for a small number of people, especially kids under 5. And when you multiply a small, you know, incidence of severe outcomes across a very large group of vulnerable people, you do start to see high hospitalization rates and really bad and lifelong effects of measles in, you know, babies and young children especially. And in our adults, we're actually seeing quite a high hospitalization rate as well. It's a severe illness on its own.
A U.S. doctor we spoke with says while it's not religious groups in America, the higher rates of unvaccination can also be traced back to the pandemic.
Over the last 3 years, we've had the most religious exemptions filed, for example, to public schools by parents to exempt their children from vaccines, but these are not specific religious communities. It seems like there's just a general desire not to vaccinate children.